Good morning. We're getting started a little bit late, which is fine because I'm happy to see everybody who's here bright and early. Really thanks for coming this morning. We have a really, I think, an exciting program in this tract where we're going to dig into the science as well as highlight some related concepts like best practices in clinical studies and some ethical questions of doing research in this field. But before we do that, I'd like to introduce Thomas Conlon. You all have seen Thomas yesterday, but I want to tell you a little bit more about him. He's the Chief Scientific Officer of the Michelson Prize and Grants Program, and we would like to thank the MPG program for sponsoring this track and for its incredible commitment to developing a non-surgical contraception. He has previously worked for the University of Florida, including a position as director of the Powell Gene Therapy Center Toxicology Core at the University of Florida, and he received a PhD in genetics and biomedical sciences from the University of Florida. He has particular expertise in working on projects using viral vectors to deliver genes for various therapeutic uses, and he helped perform the preclinical and the clinical safety assessments for the first human AAV human clinical trial. So he worked with the veterinary researchers at University of Florida, where there's a great vet school that had some really important expertise in reproduction, and many of the students that he mentored went on to veterinary school. So he's part of our veterinary research community. He's published extensively over his scientific career and has many professional accomplishments, but I'll just highlight a couple. He served as the editor for the special issue on human gene therapy of the Human Gene Therapy Journal, and he also served on 2 committees of the American Society of Gene and Cell Therapy. He'll say a few words about the Michelson Prize and Grants sponsorship, and then I'll come back to briefly outline the rest of today's program.
Thank you, Linda, and for that introduction. The Michelson Prize and Grants and Found Animals Foundation is happy, really thrilled to be able to support this contraceptive track, especially as it relates to some of the research being performed with our grantees and our current focus, primary focus on molecular medicine being used as a technology for our goals here. I'd first like to recognize our grantees that are here, and some of them will be speaking today. If you wouldn't mind raising your hands, David Pepin over there. Nihal Korkmaz, is she here yet? I don't think so. She's from the David Baker Lab, Christina Gabello. Maxence Delachari, right there from the Mooney Lab. And thank you all for attending. And in addition, our fantastic advisory board, of which many are a part of the ACC&D board as well. And we have a variety in attendance: Kevin Morris, Lyndon Rhodes, Carl Johnson, Graham Cox right here, and hopefully I did, and Bill Swanson over there. So together we really have an awesome group of people on our board and represented in the ACC&D board as well. I think some applicants are quite surprised at our range of expertise when they get their reviews back, which exemplifies the awesome group that we've been able to put together. And foremost, Gary Michelson, Dr. Gary Michelson, our benefactor, has demonstrated a long-term commitment to this goal and sends his regards as well. I hope you enjoy the talks this morning and of course, the panel discussion to follow. And please feel free to ask any questions at that time, at any level. And again, enjoy.
So, yeah, I would just like to reiterate that one of the evolutions of the research funding in this field is that years ago when Gary had been building spay-neuter clinics in Los Angeles. I don't know if all of you can know this history, but he built 7 spay-neuter clinics in Los Angeles and was frustrated that he didn't seem to be making a lot of progress in controlling feral dogs and cat population and in really making a difference on shelter euthanasia as well. And he had the idea that we should have a non-surgical contraception. And through a number of iterations and conversations with a lot of people, he decided to put forward a prize. He kind of modeled it after the X Prize. You know, if I put a big money prize out there, somebody will build it and win the prize. And ACC&D worked with him on kind of defining the prize. And then we said, but the problem is there's no research money for research in cat and dog reproduction. There's NIH doesn't fund it, NSF doesn't fund it. You know, there's a little bit of money from the Morris Animal Foundation, but there's just no money. So even if somebody wanted to win the prize, they don't have the financial wherewithal to do the research to get to that point. And he said, okay, well then I'm going to start a $50 million grant program. And that was really the genesis of this whole effort. So he recognized the need, he was stepped up to meet it, and the fact that his commitment has been this long-term is really a testament to his dedication to this field. So I'm just delighted to have him sponsoring this session. So I'm going to tell you how the rest of the day is organized. Kevin Morris is going to moderate our first session on gene therapy, where we're going to hear about new research, and then there'll be a panel to follow with discussion and questions. So you'll have about a half an hour opportunity to ask a lot of questions about these approaches. Then we're going to take a break, and following the break, several speakers will discuss some experience in the field use of the GnRH vaccine in cats, followed by an abstract discussing a new approach for a GnRH vaccine formulation. Then lunch is again sponsored by PetSmart Charities. And the afternoon will start with some additional presentations on contraceptive science, followed by a panel where we're going to talk about how you conduct trials in dogs and cats, from a laboratory science, laboratory research, to a clinical research, to field research. So we'll have a panel talking about just kind of some of the issues and opportunities in doing that type of research. And finally, we're going to have a talk at the end of our tract on consideration of the ethics of doing research in this field. And then we'll all get back together. Actually, the other tract folks will come in here, and then we'll talk about the future of contraceptive products. So it should be a full day. And with that, let me introduce Kevin. Kevin Morris is going to be our moderator. He's a research associate professor at the University of Denver in Colorado, where he's the director of research for the Institute for Human-Animal Connection. And his work focuses on the human-animal bond and advancing animal health and welfare. He's worked on a number of cutting-edge programs, including understanding how interaction with animals may help children with severe psychosocial challenges, and also the impact of intensive animal welfare programs across the entire One Health framework in collaboration with HSUS Pets for Life. There's just a couple of examples of the wide-ranging work he's been doing. He has a really interesting background. He has a PhD from University of Chicago in biochemistry and molecular biology. And he's one of those people that spans academic research and industry, because he worked on a human biotech company for several companies. And he was a founding partner of a company called Sirius Medicine in Colorado. He was the director of research at the Animal Assistance Foundation, and he's published widely in peer-reviewed journals. So with this background, he's uniquely placed to understand how cutting-edge biomedical science can be brought to bear on pet population control. He's on the board of ACC&D and on the scientific advisory board of the Michelson Prize and Grants. So Kevin, it's all yours.